Heart Care Foundation of India. I welcome all of you to our 74th webinar. This is something that Dr. K.K. Agarwal had started with the aim of educating the medical fraternity, the nursing community, and it was something very, very close to his heart. We continue to carry this forward. We all know during the pandemic, the importance of health and well-being has come to the forefront. And, big thanks to everyone who's associated here for taking out time on a Friday afternoon to come and learn, to our speakers, to our co-hosts. We couldn't do this without you. So thank you so much for continuously supporting us and continuously supporting the endeavor to really make India a healthier country and a healthier nation, something that is definitely a priority now. I would now like to extend a very warm welcome to our co-host for today, Professor Dr. Manju Chugani, Dean, School of Nursing, Sciences and Allied Health, Jamia Hamdard. Professor Shani Thomas, HOD Department of Medical Surgical Nursing, Shri G.H. Patel College of Nursing, Bhai Kaka University, Anand, Gujarat, and Ms. Simbal Babu, Professor, Holy Family College of Nursing, Delhi. Thank you so much to all three of you for joining us and your support. Truly appreciate it. Can I invite Manju ma'am to now say a few words?
Thank you so much for inviting us for this webinar. And I'm happy that we are continuing with the legacy and the path which was shown by Dr. K.K. Agarwal, President Heart Care Foundation of India. And the topic we have chosen this week, importance of golden hour in heart disease, is very apt, and recently I have experienced it myself because my father was in hospital, who is around 90-year-old, and because he was in hospital and we could really make use of this golden hour there, he could survive. Otherwise, we would have lost him on that same day. So it's very, very important, and I think today's speaker has already worked in cardiology ICU and cardiothoracic ICU, in fact, and he would be able to tell us what all we can take care and are very important aspects of this golden hour and what is our role which we can play. Today, I think many of our students who are studying in paramedical department of Jamia Hamdard, I'm heading that department too. So they are here with us, and I've asked them to not to attend class today from 2 to 3, attend this session, because this session is very important for each one of us, because each one can play their role in this. Not necessarily that only doctor can help in this golden hour. There is a role of every person in this golden hour, because to help the patient to reach to the right place, then after reaching the right place, to hand over to the right person who can further do intervention. I think all these things are very important, and we are going to listen to this. And I would like to welcome my two most important co-hosts who are with me, and they will also speak on this for some time, as Dr. Ms. Naina will say. And I think all the best, and let's keep more time for speaker and for question answers. Thank you.
Thank you, ma'am. Totally agree. I mean, even Dr. KK, this was a subject which was very, very close to his heart. As a part of our NGO, we've trained over 3 lakh people on hands-only CPR. We've been speaking about how each one of us can play a very, very important role, in preventing deaths due to cardiac disease. And how do you actually bring awareness in the entire nation about this? Because most people aren't aware, right? Most people panic. So that's the program that we've been running. He came up with the slogan ki apni chhati peetne ki jagah dusre ki chhati peeto, to kind of say that you start panicking and you start crying. So instead of doing that, save the person in front of you by learning CPR, which each person can do. So this is definitely a very, very important topic. So without taking too much time, can I now invite Professor Shani Thomas to say a few words?
Thank you, madam, for the warm welcome. And today, like the topic what we have got, that is the golden hour, that is night peak and it's the need of the hour as the madams have already stressed the importance of this problem. And if you see, we are living in a world which is ruled by the non-communicable diseases. And if you see, the cardiovascular disorders is in the top among all these things. And the survival of us, that mainly depends on how we address these issues, how seriously we take these non-communicable diseases, especially the cardiovascular disorders, how we respond them. And I think in today's session we will be addressing most of these issues here. And when we say, as the name suggests, it is the golden hour. So the name itself has its significance because it is a golden opportunity, the first 1 hour that a patient gets after experiencing a cardiac arrest or a heart attack. It is a golden opportunity for a patient for survival, or we can say that it is a bridge between survival and death. And the faster we travel in this bridge, that decides whether we are moving towards our survival or towards the death. I think so this is the correct topic that is selected for discussion and the need of the hour, because most of the people are unaware of the early warning signs of the cardiac disorders. So without taking much time, so I hand over the session to Ms. Simil Babu for further proceedings. Thank you.
Simil ma'am.
Hello, very warm good afternoon to one and all present here. Happy to be again part of Dr. K.K. Agarwal's Heart Foundation of India. We had learned a lot from him, and we remember his those classes which was so contributing to our knowledge. And today the topic which selection was regarding the golden hour after a heart attack. It's a really it's a very important topic you have chosen for the session, and it is we are looking forward for a good session. And yes, currently India, although India is contributing for approximately 20% of world's population, the data shows that approximately 60% of heart disease burden is India only. India is contributing for about 60%. And 50% of heart attack occurs in age less than 50 years. That is another important aspects of today's session, that recognizing the first hour and the signs and symptoms and managing the first hour we will be able to reduce the number of deaths. That is what I have learned from data. And today's session, I am thanking for all the organizers as well as my co-host for this session. I am handing over the session to Mrs. Naina Agarwal Ahuja. She's a trustee at Healthcare Foundation of India for further proceeding of the session.
Thank you so much. Thank you, ma'am. I would now want to, like to extend a warm welcome to our speaker, who's taken out his time to educate all of us on this very important topic. So, inviting Mr. Shinoj KR, Nursing Superintendent at Modern Hospital. We are looking, he's graduated from the University of Calicut. He's worked in cardiothoracic ICU Polo Hospital, Chennai. He's currently working at Modern Hospital. So he's definitely an expert who can really, who's got hands-on experience and can really help answer all our questions and take us through the important aspects of identifying, a sudden cardiac emergency, what to do in such a situation, what can each and every person in the healthcare fraternity do and outside also, and what is the importance of training. Plus, we've also seen, in the past 2 years of the pandemic, the incidence of heart disease is increasing. A lot of people have not got regular checkups. A lot of people have kind of missed out on their timely preventive practices, because of which the incidence of heart disease is rising. So over to you, sir.
Thank you, madam. Thank you, everyone. Good afternoon, everyone. Myself is Mr. Shinoj. I'm working as a nursing student in Modern Hospital, Kodangallur. Am I audible?
Yes, we can hear you.
Hello?
We can hear you, sir.
Okay, thank you. So, I'm informed about the topic yesterday only, so I feel whether I can deal the topic in depth because I have prepared in a very way, because the target group is nursing students. So let me share some in details in the level of nursing students. Okay. Thank you. Thanks for the opportunity. So, shall I share some slides?
Yes, definitely, sir. You are a
Okay.
co-host, so you can share the slides. We can't see your slides yet.
Okay, so let's start with this one. Golden hour. As you said, it's a need of the hour.
Sorry, sir, I can't see your slides yet, I think.
How's it now?
No, I'm not able to see the slides.
How's about now?
No, just
No.
your video is gone off. We can't see the slides.
I've shared it. I've pressed the share button and selected the one.
Can you try now?
Okay. Can you see this one?
No, I can't. I don't know if anyone. Okay, now it's starting. Yeah, now we can see it.
You can see.
Yes, now it's perfect. We
Okay,
can see the golden hour slide. Yeah.
As you said, golden hour is the so the topic is the need of the hour actually. Really, golden hour is the 60 minutes, which is the first 1 hour of the heart attack. The golden hour is applicable to heart attack, not only heart attack, stroke events as well as trauma. But we are in this session we are talking about the golden hour in heart attack. That is cardiac. Okay. God.
The screen
Some
share.
problem with sharing, I think.
We could see it earlier, but I can't see it now. Yeah, we can see it now.
So what is golden hour? The first hour of the onset of a heart attack is called golden hour. You know what is heart attack? It is the heart attack starts from the atherosclerosis, the plaque formation, as well as blockage of blood through the coronary arteries. The event is started from that point only, atherosclerosis. And why the golden hour is important? If proper treatment is given during the golden hour and proper blood flow to the heart can be restored earlier, at the earliest, we can save the patient. The heart muscles can be saved from dying. So here the heart muscles are very important. The condition of the heart muscles, prevent them from dying is very, very important. That's why golden hour is most important. The first hour of the heart attack is very important. What should one do? With the onset of chest pain and other symptoms, as you know, vomiting, sweating, the radiating pain, as the book picture says, rush to the hospital to get treatment within the golden hour. When you feel chest pain or when you see somebody who feels chest pain, bring that person to nearby hospital, preferably having a cardiologist in the hospital, and start the treatment then itself. Okay. So as I said, the first hour of the onset of heart attack is called the golden hour, the 60 minutes. Appropriate action, that is the treatment within the first 60 minutes of a heart attack, can reverse its effects, its consequences. That's why it is very important as golden hour. As somebody said in explaining the scenario today, the golden hour, most death and cardiac arrest. There is difference between cardiac arrest and heart attack, because heart attack is a circulatory problem, circulation problem in the circulation, blood circulation, and cardiac arrest is preferably a most rather an electrical problem. You know, the electrical activity of the heart that is being stopped. So there is a slight difference between cardiac arrest and heart attack. So most death and cardiac arrest occur during this golden hour, in the first period, first 1 hour of the disease. If a person gets treated within the period, she or he can expect near complete recovery. I repeat that word, near complete recovery, because otherwise it will affect the consequences, affect the later recovery of the of patient. So near complete recovery, that's very important.
If you're having an issue, you want us to share the presentation?
Ma'am, pardon?
I'm saying, do you want us to present the presentation in case there's a problem in your phone?
Yeah, there is a problem in sharing because I have to close every time.
Yeah, so
after,
can you
explaining.
maybe send it to us on chat and we can keep changing the slides?
Okay, sure, I'll send you.
Yeah.
Okay. So for that, I just stop closing this one window.
Yeah. You can just send it to us. Any of us will share it.
I have sent it in WhatsApp, madam.
On WhatsApp? Okay.
Yeah.
So just give us 2 minutes. Till then, if anyone has any questions on what has been asked, you can ask sir any of those questions. We are just sharing the screen in a minute. Sapna, can you please share the screen? Can you see my screen?
Yes.
So is this the right slide?
Okay,
Yeah.
now it's okay now.
Yeah.
So this is the first slide. Okay, thank you. Importance for golden hour in heart attack. That's already been finished. Next. Okay. That's the first slide. We have finished it.
Yeah.
Next, ma'am.
Yes, 1 second. I think it's hanging. Yes.
No, not that one. Next one. Next. Yeah, it's been finished. The first 1 hour after the onset of the heart attack is called the golden hour. Appropriate action within the first 60 minutes of heart attack will save the patient. Okay, that's been over. Next. That's been explained. Was death and cardiac arrest been? Yeah, this is the difference between cardiac arrest and heart attack. As you know, as you see in the slide, cardiac arrest occurs when the heart malfunctions and stops beating unexpectedly. Rather, an electrical problem, but heart attack is a circulation problem. So there's a difference. Okay, thank you. Next. Next. Okay, here it is. It's a window for the first 1 hour. The golden hour is a window of opportunity also. Every cardiologist know or they believe time is muscle, because as time progress, the muscle get necrotized or died because of stoppage in blood circulation. So time is muscle. You have to remember that. Irreversible damage begins within 30 minutes of blockage. The damage itself starts within the first 30 minutes. And the heart muscle starts to die, completely die within 80 to 90 minutes after it stops getting blood. And within 6 hours, almost all the affected parts of the heart would be irreversibly damaged. So this is why the golden hour is important. And we get an opportunity to save the patient in this period. The amount of damage to the heart muscle depends on the size of the area supplied by the blocked artery and the time between injury and treatment. You know, the is supplied by coronary arteries. The coronary artery originated from the root of aorta, which is divided into right coronary artery as well as left coronary artery. Again, they branches. Right coronary artery mainly supplies the inferior wall of the heart. So, in the blockage in the right coronary artery produces inferior wall MI, and as well as the left coronary artery blockage produces anterior wall MI, myocardial infarction. The amount of damage due to heart muscle depend on the size of the area supplied by the blocked artery and time between injury and the treatment. That's why the time is muscles. Time is very important, and the golden hour is very important in saving the muscles. Okay, next, ma'am. One more window of opportunity is there.
This one?
One more window of opportunity is there. Slide.
These are the only ones I've got.
Okay, the rose one, yeah, that rose one.
This one?
The rose one, yeah,
Yeah.
that's it. So, other than the damaged heart muscle, the most common killer, I want to say, so killer in the early period are abnormal heart rhythms. You know, the abnormality in heart rhythms, arrhythmias, ventricular tachycardia, as well as ventricular fibrillation. So these two may cause death of such patients. So we have to prevent these arrhythmias. Heart muscles contract at a rapid rate, but no effective pumping of blood takes place. That's what actually happened there in arrhythmias. Heart muscles contract, they just beat, it's not actually beating, they just vibrate, but they heart can't bleed outside to different parts of body, especially to brain. Brain death will happen, and to kidneys, there will be acute kidney injuries. So heart muscles contract, but at a rapid rate, but it cannot pump the blood to outside of the heart. Once the patient reaches a medical facility, the heart rhythm to be assessed first, because to find out the patient has any arrhythmia, so we have to prevent that one first, arrhythmias. In saving the life, preventing arrhythmias or correcting arrhythmias, treating arrhythmia is very important. A shock, that is called a defibrillation medically, can be delivered according to the rhythm. The shockable rhythms are ventricular tachycardia without pulse and ventricular fibrillation. For finding out that, for you have to study what is ECG, what are the ECG changes during ventricular tachycardia, what are the rhythm changes during ventricular tachycardia as well as ventricular fibrillation in ECG. A shock can be delivered according to the rhythm, and administering some medications like adrenaline or anti-arrhythmic medications shall be done. And after giving you a CPR or some life-saving treatments, practices, on return of spontaneous circulation, ROSC, further medical or surgical. Sometimes the patient may need angioplasty or CABG, coronary artery bypass graft. Such protocols shall be followed. Okay, next. Yes, terms to be familiar. That's what I want. So before going to the golden hour management, you have to familiar with some terms, the common terms which we use in cardiology. The first one is stable angina or angina pectoris. It is stable, and it is called as stable because it is predictable. Actually, we know the pain will come in such certain situations that are predictable. Stable angina often occurs during exercise or emotional stress. That we know that during exercise the pain may come, and during emotional stress the pain may come when your heart rate and blood pressure increase, and that at that time blood pressure as well as heart rate increases, and your heart muscle needs more oxygen. And lack of oxygen, deprivation in oxygen leads to ischemia and later infarction, that is myocardial infarction. So first you have to familiar with the stable angina or angina pectoris, and we have unstable angina also. These sometimes refer to acute coronary syndrome, but stable angina, unstable angina, myocardial infarction, all those comes under acute coronary syndrome. Unstable angina occurs while you may resting or sleeping. It is unpredictable or with a little physical exertion. It comes as surprise. It's not predictable. Unstable angina can lead to heart attack, and it should be treated as an emergency. So these two terms, stable angina and unstable angina. Next. One more times to be familiar, and STEMI. So
These are the only slides I've got.
last one, the blue one.
This one?
Next to that, yeah. Oh God.
I haven't got the other slides.
And we have to familiar with some more times, STEMI and NSTEMI. STEMI means ST elevation MI. You can find out ST elevation, ST segment elevation in ECG. Such MI are called ST elevation MI. That is due to infarction, the complete blockage of the coronary arteries. And non-ST elevation MI, the ST segment is not elevated, that is depressed in some kind of MI, and it is due to partial blockage of the coronary arteries. So these are the terms to be familiar with when you're dealing with the golden hour or cardiac issues. Next, madam. Pathophysiology.
These are the only slides we've got.
Okay, I'll share that.
Yeah.
Okay, next we move on to the pathophysiology of the myocardial infarction. So familiar with this one. The three reasons: atherosclerosis. As I said earlier, atherosclerosis is the plaque formation inside the coronary artery which blocks the blood. The atherosclerosis starts from a endothelial injury. Endothelium is the inner lining of the coronary artery or any artery. The injury to endothelial lining by hypertension or any other reason, atherosclerotic plaques forms. Then arterial spasm, that's a constriction of the artery. Then plaque rupture or thrombus formation. All this leads to reduced blood supply and increased oxygen demand. All these three factors will block the coronary arteries and blood circulation will be cut off. That will lead to ischemia, the the partial block due to partial blockage of the coronary artery, ischemia will be resulted. Then ischemia will lead to the permanent necrosis of the cardiac muscle. That will lead to myocardial infarction. This is how the pathophysiology of the myocardial infarction happens. So the muscle is very important. That's why I told you muscle, time is muscle. To save the muscle, to save the muscle means to save the life at the earliest. Okay, next.
You'll have to project the slides. I don't have any more slides.
One more slide, sir.
No, I don't have any more. Yeah.
Yeah. And there is a significance of gold now. And when you receive a patient with a chest pain or a heart attack, what do you do as a healthcare worker? So when you see some patient, person with a chest pain or a heart attack, immediately bring the person to nearby hospital, preferably having a cardiologist on duty. Brief history collection and professional diagnosis is done by doctor as well as the nurse. Vitals are checked, including SpO2 and pain. The pain is very important there. So we have to manage pain also. Oxygen is delivered to reduce tissue hypoxia. That's why we measure the SpO2, saturation of oxygen. According to that, oxygen is delivered to reduce the tissue hypoxia. ECG is taken, may not be reliable always, but in most of the cases, ECG is reliable. But we should not stop with we should not rely on that much, because the result may vary or may be wrong. Then cardiostat medications. Usually we give ecosprin 325 and clopidogrel 300. Analgesics. Morphine is the right of the cardiac pain patient. So usually we give morphine. Then in the first hour, all these measures we do in the first hour of the heart attack. That is in the golden hour. Cardiac biomarkers like CKMB, troponin are sent to be done. Echocardiogram is performed to find out the pumping of the heart, the condition of the heart walls, the condition of the valves. Okay, so echocardiogram is performed in the first hour. Need of thrombolysis with streptokinase is determined. In some patients, we need thrombolysis. That's according to situation. When the patient is aged, we can't do angioplasty or CABG. We will go for thrombolysis with the streptokinase. Angiogram is performed followed by PTCA if needed. So first we will perform angiogram to find out the number of blocks and location of the blocks, the thrombus, and followed by PTCA, percutaneous transcoronary angioplasty. And some patients may need CABG, CABG, coronary artery bypass graft surgery also.
So, sir, I have a few questions, and I'm also getting some chat questions on the chat box on Facebook, and because this is being streamed live across our platforms. So, one, people want to understand what is the role that medical practitioners can play in educating the public about recognizing these symptoms. So, what is the easiest way of explaining what the symptoms are? What to do if someone is suddenly having chest pain in front of you? How do you make sure every family, every individual is aware of that? Because a lot of people ignore it and they delay the, going to the hospital itself, because of which they miss the golden hour.
Okay. To educate the people, the public about the golden hour as well as the heart attack is very important, because all the public should know. Even in United States and abroad, school students are trained in providing BLS, so in our country also, the public should be aware of the basic life supports to find out the symptoms of the heart attack or cardiac issues. The main symptom of heart attack is pain itself, because the central chest pain may radiate to back or neck. But the scenarios, the thing is not similar in every patient, every person. The book picture may vary in different persons, because even a throat pain can precipitate to heart attack. There is only throat pain. In diabetic patients, there will not be any pain. It will be silent ischemia. So about these symptoms, it's a responsibility of the cardiologists as well as health workers who work in cardiac units to make the people aware of the symptoms as well as to promote them to find out the treatment as at the earliest,
And what are those 5 tips that you would give all the medical practitioners here and the paramedic staff as to how should they be communicating with, say, heart patients and their families, or anyone who's high risk with a family history, with someone who's got diabetes, hypertension, and so on?
Okay. First of all, knowing the history collection is very important. The familial history, the familial background may lead to some people are from some person who have parents having this kind of cardiac issues are more prone to get heart attack. So the health history is very important. So tell those people to be aware, to be alert about cardiac issues in future. So educate them. So then educate them about the signs and symptoms of the heart attack. Mainly pain, then vomiting, sweating. The fatigue during or palpitations during exercise. Such symptoms, the symptoms of what text says, we have to distribute it to the public. We have to make the public aware of these symptoms. Then educate them to find out to seek the medical attention at the earliest after getting this kind of coronary artery disease or cardiac issues. Is it okay, madam?
We have a question in the chat box. What is the concern after recovering from a heart attack? What are the things that someone should keep in mind?
What should be done after heart attack?
Yeah.
That's already been explained in the session itself. Seek the medical attention at the earliest.
After recovering, the question is after recovering from a heart attack. So if someone
after recovering, okay, fine.
Yes.
That's something which is related with health education. We have to obviously avoid the life. We have to change the lifestyles. We need a lifestyle changes. There are factors which predispose the heart disease, like hypertension, diabetes, age, obesity, all those things. So we have to modify them. We can't modify our age, but we can modify the lifestyles, the habits. We can stop the alcoholism. We can stop the smoking. We have to change our food styles, eating habits. So all those things.
Yes.
Anjana?
I think immediately after recovery, because recently my father had arrhythmias and then he was taken care of. Then immediately after that, after recovering from this phase, we need to advise the patient and the relatives also to avoid any stressful situation. जैसा डॉक्टर साहब बताते थे ना, ऐसा अपना नहीं करो, उनको calm, quiet situation, and don't show that panic to the patient.
Sorry, ma'am, to interrupt. And the most important is to continue the medication, like Ecosprin as well as clopidogrel.
Yes, that's what I was coming to. The medication part which they have prescribed, immediately they have to take, and usually they give sublingually, keep that tablet with the patient if these signs or that tightness in the chest occurs again. Then in that case, sorbitrate is, or what is given, Shinoy? What is given? Sorbitrate is given?
Yeah, sorbitrate, obviously.
Yeah. And also, I wanted to ask you for my paramedical students question. We have cardio bachelor in cardiac techniques. And these students are posted in cath lab. These students are posted in your all this emergency vans, the ambulances. So what exactly is the role of these paramedics in these specific places? And is there role of injection efcorlin, which usually these people give very readily? Should they give this or not? Efcorlin.
Efcorlin doesn't have any much role in heart attack, madam. Efcorlin is only, hydrocortisone. So it doesn't have much role in heart attack. Medicines which have main role in heart attack is, as you said, sorbitate, nitroglycerin, and after in ACLS protocol, adrenaline and antiarrhythmic drugs have more important. And as paramedics, students, what should students do is they have to learn how to identify the symptoms of chest pain. The patient may have central chest pain that may radiate to neck or back, to left arm, or throat pain, and so many symptoms like pain symptoms. Different kinds of pains are being described in textbooks also, but may not be the exact textbook picture in real life. It may vary. As I said, there may be silent ischemia, so there will not be any kind of pain, but the patient have breathing difficulty. It's a main symptom of heart attack. Breathing difficulty. The breathing difficulty or dyspnea may be due to COPD or pulmonary issues, and also may be due to cardiac issues. So they have to recognize which is pulmonary or which is cardiac. So the breathing difficulty is very important to find out. Then they bring the patient to next or a nearby health facility, preferably having a cardiologist. Is the responsibility of any person who see the patient or a person who experience chest pain. So that's the fundamental function of a paramedic, to bring the patient at the earliest to the hospital. Then giving CPR to a BLS protocol first. As far as BLS is concerned, ABC, check the alert of the patient. You just pat the shoulder of the patient to check the alertness of the patient by calling their name, if you know, or just hello, are you okay? Are you alert? And if the patient is not alert, you check the breathing pattern of the patient by checking the chest movements. You have to see the chest movements for 10 seconds. And if it is not present, you have to palpate the carotid pulse for 10 seconds again. So if you don't get the carotid pulse or carotid pulse, if you cannot feel the carotid pulse, you can start the cardiac massage in 30:2 ratio. 30 means 30 compressions. Putting your hands, both the hands over the lower third of the sternum, that is the central chest bone, and giving cardiac massages at least for 5 centimeters depth, then allowing the recoil of the sternum, 30 compressions, then giving breathing, artificial breathing. Protocol. After in between, you call for help. Giving in between giving the CPR, before starting the CPR, you have to call for help. You call for an ambulance if you are outside, or if you are in the hospital, you call for help. For that, you have in your hospital, you may have code blue announcements. So call for help. Then after reaching the code blue team, you have to start the ACLS rhythm, ACLS protocol, as directed by American Heart Association. So that's it. Hello.
Thank you.
And some more points about ACLS. In ACLS, you check the rhythm first. As I said in the session earlier, the cardiac rhythm of the patient is very, very important. If it is a shockable rhythm, ventricular tachycardia or a ventricular fibrillation, you have to shock the patient with a 300 or 200 joules. So delivering shock is an important thing to revert the heart rhythm. Then administering adrenaline, it's a life-saving drug. Administering codron, it's an anti-arrhythmic drug. So such medicines are administered based on the order from the physician or a cardiologist. So that's all about the ACLS rhythm. So all these things are happened in the first hour of the heart attack. That is the 60 minutes golden hour of the heart attack. That's why it's very important in saving the life of the patient. That's the matter.
Swati Tiwari has a question. Can you please unmute?
Hello.
Yes, we can hear you.
Can you just explain about silent heart attack and the symptoms?
Yes, of course. Yeah.
Yeah, madam. Silent ischemia is commonly seen in diabetic patients as well as hypertensive patients. There may not be a strong chest pain or central chest pain, but the patient obviously having a dyspnea, breathing difficulty. So we have to, if you see a breathing difficulty, get an ECG at first, because we have to recognize whether it is pulmonary or cardiac. So for that, the help of an ECG is very important. So you take an ECG, get an ECG in the first step. So from that ECG, we can understand whether it is ischemia or not. Okay.
Simran ma'am, any other question? I will then take a question from Swati. Swati Tiwari, can you unmute yourself? Okay, while she is doing that, we've also got another question that says, "Sir, do respiratory problems can they be a cause for cardiac arrest or heart attack?"
Respiratory problems. Okay, that's depend upon the pathophysiology of the disease. The heart problem and the pulmonary problems both are interrelated, because the right ventricle connected to pulmonary lungs. So any problem in the heart or any problem in the lungs will affect both and vice versa. But COPD as well as asthma, that is the exclusive problems of the lungs. But pulmonary edema is the consequence of this acute heart failure. It is a consequence of the heart problem. So in that way, they are interrelated.
Shani ma'am, do you have any question?
Yes. Sir, can I ask you one thing? Like, is there any symptoms that will differentiate heart attack and the cardiac arrest?
Heart attack and cardiac arrest. Okay, sure. Cardiac arrest, as I said earlier, cardiac arrest is a electrical problem, electrical blockage of the heart. The electrical conduction system of the heart. There may not be a circulatory problem or a blockage in the coronary arteries in case of cardiac arrest. The heart attack may lead to cardiac arrest, but both are different. Slight difference is there between cardiac arrest and heart attack. The cardiac arrest is mainly with the conduction problem, the electrical problem of the heart. There is a blockage in the conduction of the heart.
Okay, sir, but what would be the difference in symptoms, what the patient seeks, or is there any specific symptoms which says that the patient has developed cardiac arrest or the patient is in heart attack stage?
Okay, cardiac symptoms means heart attack symptoms, as you know, the pain and the textbook picture says. Yes. Cardiac arrest symptoms are mainly the unconscious state of the heart, a patient, and it is detected through ECG, and the pacemaker may need to revert the rhythm of the heart.
Okay, sir. Thank you.
Do we have any other questions? I know Shinod sir had to leave a little early, so then we can wrap up. I would like to share one of Dr. K.K. Agarwal's videos explaining CPR that he had recorded. So I'm just going to quickly share that.
One more, madam, one more clarification. As the conduction problem of the heart, there will be a bradycardia, but to identify that, we have to monitor the rhythm of the heart. There will be bradycardia, of course. So the symptoms of bradycardia will be fatigueness. Okay, of course. And there will be arrhythmia also. Again, there will be palpitations. So these are the symptoms of cardiac arrest. And the patient will be unconscious, obviously. The patient will not be responding, because both heart attack and cardiac arrest will affect the brain as well as all the symptoms of the body. Okay.
Thank you, Shinod sir. I'm just going to share.
Thank you. Thanks a lot for this opportunity. I think because I'm informed yesterday only, I couldn't prepare much more.
No. Thank you so
Sorry
much.
for that.
Yeah.
And I'm informed as the target group is nursing and paramedic students only. So I just touched peripherally only. I didn't go in depth. Thanks for the opportunity for
yeah, this was super helpful. I'll just share the video and then we can go to the vote of thanks.
Okay, thank you. Shall I go? Please?
Yes, sure. Yes.
Thank you. Thank you.
Thank you. Can you
to learn CPR? The only thing required is your two working hands and your intention to save a life. If you feel that a person is clinically dead, make him lie down on a hard surface like the floor. It should not be the bed. It should not be the couch. It should not be the sofa. Now you need to confirm whether the patient is actually dead or not. Very simple. First of all, a person who is clinically dead will not respond. So produce a pain in any area, and if the patient has no response, look for respiration. Either hold your hand in front of the nose, there will be no warm air coming, or you see there is no movement. Presume that the patient is clinically dead. Once you have clinically confirmed, push hard, act fast. So what you have to do is stand on your knees, interlock your hands, straighten them, and take the palm and keep it on the center of the chest in between the two nipples. And then come forward so that your shoulders and hands are in a straight line, and then push hard and push fast. Hard means at least 2 inches, and fast means minimum 100 to 120 times per minute. And you can speak 1, 2, 3, 4, 5. Like that, you can continue speaking. Continue this hands-only CPR till the person revives or an ambulance appears with an electric shock machine. Yes. So whenever you're doing CPR, ask for help. Hey, somebody call the ambulance. And ask the ambulance to bring an electric shock machine and continue CPR. So sometimes you have a person who says his one hand is not working. What to do it? You can do it with your elbow. You can do it, push hard. 1, 2, 3, 4. You can do it like that. So suppose a person has no hands, he can do it with the leg. See here, 1, 2, 3, 4, 5, 6, 7, 8. So is it difficult? No, absolutely not. Even a 4-year child can learn. Even a 99-year-old man can do it. So everybody can learn it. The only thing you have to remember is push hard and push fast. Minimum 2 inches, minimum speed of 100 to 120 per minute. And if you do that, you can revive a person.
Yeah. So I just wanted to show that video because that is the project that we run and that is what we keep training people. We have trained the entire Delhi police force a few years ago.
With meningitis, meninge refers to the meninges, which are...
Yeah. So that's the program that we've been running. We've been training as many people as we can on the technique of hands-only CPR. We've trained people in schools. In fact, next week, the entire week, we're training people in different schools in Delhi as a lead up to World Health Day. So we're training about 500 to 600 students every day, the entire of the next week on the technique. So it's definitely a very, very important subject, and thank you everyone for joining us. Can I now invite Professor Shani Thomas to give the vote of thanks?
Thank you, madam, for the invitation. And we are towards the end of today's session, and I'm very sure that the speaker could establish the significance of our today's topic, that is the golden hour. So as sir has said, the first 60 minutes is important in the life of any patient who is experiencing heart attack. So this is an opportunity of window, so where the doctors can take prompt treatment, intervene immediately so that the person further does not develop into a cardiac arrest, and it can improve the survival of the patient. And one thing that comes to our mind when we think of or when we hear about heart attack is something that happens very abruptly. Actually, the fact is that it is not something that happens all of a sudden. So there is a mechanism by which our body gives us information that there is something wrong that is happening. The only thing that is needed is we should pay attention to what our body is trying to say, understand it, and respond it immediately. So according to the report by CDC, which says almost more than 50% of the patients with heart attack which dies before reaching to the hospital. That again further implies the significance of understanding the warning signs that our body gives at the earliest and respond. Most of the time we fail to notice, and even if we notice, we fail to understand or we fail to acknowledge that there is something wrong. So it is high time to think differently, understand the importance of this golden hour, and take action promptly. So with this, I conclude today's session, and I take this opportunity to thank Mrs. Naina Ahuja as well as her organization for their greatest efforts in creating awareness about the public, among the publics as well as healthcare professionals about the various lifestyle disorders and how to tackle these lifestyle disorders as well as the services they extend to the society. I thank today's speaker, Mr. Shinosh KR, Nursing Superintendent, Modern Hospital, Kodungalur, for his highlights and thoughts on the topic that is given. Then I thank my co-host, that is Dr. Manju, as well as Ms. Simil, for their valuable inputs and thoughts. And lastly, I would like to thank all the participants for your enthusiasm and active participation. So that is what brought us together in one umbrella. Thank you all once again.
Thank you, ma'am. Thank you so much. Thank you, everyone. Sorry for the technical glitches today. That's unfortunately a part of our Zoom life now. But thank you so much. Wishing everyone a healthy and a happy weekend.